Okay, welcome back, YouTubers. It's your boy Tony. I'm doing a part two of this, but it's basically in response to one of these sarcastic, snarky, antagonistic, condescending people under my comment section. And I'm gonna just clarify something. No, I do not have a medical background. No, I am not no doctor. No, I am not part of the medical practice or whatever. However, I do read. However, I do watch the news. However, I do see where there have been trials, test trials, and people who are test subjects to certain trials and the results stemming from that. That's what I'm referring to as paying attention to detail. Prior to that, going further beyond or prior, that when I speak on certain things, and I'm gonna bring this back up as a point of reference when I want to use the example going back into history, where many of people, when it comes to this vaccine that they're trying to push out so rapidly and not really taking into account what may be harmful to people's health because they're just worried about how fast they could push out the vaccines and whatever the trials are, and they'll fudge numbers. They'll make light of some of the side effects, um, just to how should I say, push a narrative and persuade the public's perception to say, hey, what we have presented to you is guaranteed to be successful under this percentage, this percentile rate. Okay, it's funny how when they say history repeats itself, people disregard history because they rather forget it. But unfortunately, there are people who, as I said, I pay attention to detail. I do my research. I look things up. I find things to be quite honestly interesting. And one of the point of references that, especially amongst the black community, for those that do open up a book and read, because there are plenty of us people who are educated or try to be informed. Uh, there was a time, speaking of the Tuskegee experiment, and for those of you who don't know what that consisted of, it consisted of the U.S. government experimenting on black men without them knowing, infecting them with syphilis, and for them to be reassured or not question or to have complete faith in what they were told was a vaccine of some sort, which turned out to be a lie. They had black nurses that went along with the protocol of injecting this disease, and they stood by and watched how this had affected the black men. Some who became incredibly sick, some died, and basically we were unwilling participants of being guinea pigs or being test subjects to a disease which we were tricked into being a part of. So when there is skepticism about this vaccine that they're trying to push upon us with such rapid results as they claim, you'd have you'd be stupid not to question the agenda. Whereas I pointed out before, no, I am not no doctor, but throughout my years of living and throughout my years of looking things up and studying things, especially when it came to like the AIDS epidemic and stuff like that, and all these other diseases that has come out, and cancer and all this stuff. Yeah, I looked things up. I looked up the natural remedies and all this other stuff like that. And I was like, okay, so how come they haven't come up with a cure for this stuff? I mean, you have, like I said, my kid had got his second round of vaccinations today, and the vaccines that they have that they didn't have before, they didn't require millions upon millions of dollars of research to come up with a result. They didn't have the technology that we have now back then to study and stuff like that. It was trial and error. And apparently, whatever they did, it worked for them at that time to come up with the vaccines that are available to us now when you have kids that are born and get vaccinated. But even that took time through trials and error. It didn't take less than a year. It took years to do studies and trials to perfect the vaccines. This that they're pushing on us now has not been perfected. And you're hearing the horror stories of the side effects that has been documented, that they try to downplay to some extent. So when people by right have their skepticism, who do those who feel that they can shoot down a person's having to question the motive of the government or these pharmaceutical companies who look to gain and stand to profit based off of us being their guinea pigs? And for the person that wants to sit there and come at me asking me where did I get my doctor's degree, how come you ain't using that same snarky ass comment towards Bill Gates? Because last time I checked, he doesn't have a damn medical degree, but yeah, he got his input in on the medical field and on this vaccination. Huh? But like I said, people are quick to want to sit there, snap at me with their little condescending remarks, but they have nothing to say when my rebuttal counteracts their rebuttal. So what do you have to say about Bill Gates? Being that last time I checked, he ain't got a doctor's degree, but he has a whole lot to say about what goes on with the pharmaceutical situation. Yeah, I thought so. That's what I thought. But anyway, before I get ahead of myself, speaking of health, as I said, I went to with my son to go get his immunization shots, and I was talking to my doctor, and I had my lab results come in, and I am like borderline diabetic. And as I have said before, I had to make some changes in my diet. Now I got to take this medication to bring my numbers down, whereas my kidneys aren't affected, and that I won't, and my sugar levels and stuff are at a level where it's balanced out, where I'm not into being dependent on insulin or whatever, or into the full stage of being type 2 diabetes and stuff. That's where the exercise and the diet is important. And my girl and I was talking about it, and my doctor was talking about it, and he said he just wants to see what this medication does to get my numbers back to a stable level, whereas it won't get to that point. It won't come to that stage where I have to be dependent on pricking my finger every day and checking my blood and glucose, whatever. And it's something that's a reality for some of us. But we have to, I know when it comes to black people, we hate going to the doctors. We hate hospitals and stuff like that. But it's to our benefit to get ourselves checked out. Now, since I caught it in the early stage, I'm able to manage my diet, make more healthier decisions, and because I've already had it in the plan to get myself physically back into shape, because I do have a child to take care of, I need to be able to move around more agile and not be out of breath and out of shape. Um, it's something that I have to take seriously, and I'm a little bummed about it, but I kind of have my suspicions because you know when there's a change in your body and in your health. But and I didn't have to be a expert or some medical doctor to notice these things about my own self. But anyway, that's all I wanted to share with you guys today. Until next time, until next video. Peace.